what should a woman be informed prior to wanting to get pregnant?
So this is a preconception care that most obstetricians and gynecologists give. First, we just check if you are healthy for a pregnancy. So if your weight is ideal, you're not too overweight, you're not too underweight, your BMI is good, and we run a few tests to see if your hemoglobin is not low, and if you're not suffering from diabetes, from hypertension, from any kind of genetic diseases that is running in your family. This is all supposed to be discussed. So we take a detailed history of the patient, her family, of everyone, both sides. And we make sure that there is no history of diseases that can run in the child, like thalassemias or cystic fibrosis. There are a few diseases that run in the blood, and that could be transmitted, but you can prevent it or be prepared for it, for the child not to have it.
Yeah.
So this is important. Plus, suppose if the lady is exposed to alcohol, to smoking, passive or active, or there is any drug abuse, then we have to inform her enough of staying away from it, however, so that if she is addicted, then de-addiction of it. And sometimes in the family, sometimes if you have something going on in the house, like painting or new furniture, or you are exposed to pesticides, and if you're living in an area where pesticides are sprayed often, so there are a variety of things that we inform the mother before she goes into this. We start folic acid, folvite, 400 mcg is the required dosage, but we give 5 milligrams of folvite daily to the mother pre-conception to avoid um, major genetic abnormalities in the child. And the mother has to remember to be vaccinated against rubella and chickenpox and a few other, like hepatitis B. These, or if she wants to take HPV, these have to be taken before she gets pregnant, and the doses cannot interfere with the
pregnancy.
So these are a few things we check, and then we check for her thyroid levels, we check for hemoglobin, we check for her blood group, negative blood group. Women marrying a positive blood group male, if they have a child who has a positive blood group, then it can lead to a few problems. So we run a few tests and see if she's perfectly healthy, and we give her this, and then she can go ahead for pregnancy.
Cool. That's clear. What happens now if they're trying to get pregnant and they're not getting pregnant, the woman's not getting pregnant? So when should she start worrying about infertility issues? And then from there on, what is the course of action for that?
So this is my field of expertise. I can talk about it for really long. Okay, so if the woman is less than 30, and if she has been having unprotected sexual intercourse and she is planning for a conception, but for 1 year she is not able to achieve pregnancy, that means she is infertile. But for a woman who is post 35, and we just give her 6 months of trying naturally, and if she is not able to conceive, then she needs to show an infertility specialist, not a gynecologist. You have to go in. But before this, if you think that your periods are excessively painful, sexual intercourse is excessively painful, or you have excessive bleeding during periods, or you have very scanty flow that it just lasts for 1 day, you have irregular periods, there are multiple things that need to be addressed to. So for that, do not wait for 1 year or 6 months. Just go to a gynecologist and find out the reason as to why you're suffering from this.
Okay.
These are a few things.
Okay. And infertility, so Because it's a like you said, it's a long topic. It's a whole conversation of its own, just talking about infertility. But just to give like different levels to like how you in your bio we discussed that there is some very natural treatments that you can use versus advanced treatments. So can you just at least talk about the difference between these two? What is it?
So, see, infertility can be due to, let's just divide it, due to any anatomical problem in the uterus
Mm-hmm.
or the tubes or
Mm-hmm.
in the ovaries
Yeah.
or in the past.
Yeah.
That means anything that is disturbing the sperm from meeting the egg which is coming out of the ovary, if these two do not meet due to any kind of problem, then you are going to have
Yeah.
infertility, right? Leaving apart male,
Yeah.
male sexual health problems or sperms, just talking about the woman.
Yeah.
So, when I say we can treat some things naturally, is mainly concerned to polycystic ovarian disease. So
Okay.
PCOD being such a common, I mean, it's almost become like an epidemic. Every other girl has
Yeah.
PCOD. That is because of our lifestyle changes. It is because of what we eat these days, and it is about how we are not taking care of ourselves. So, mainly, I refer to PCOD and the hormones,
Okay.
and which can be corrected if your diet includes rich omega-3 foods like flax seeds or chia seeds, or you take omega-3 fatty acid supplements. If you take care of your protein intake, that is at least 1 gram per kg of your body weight daily intake of proteins. Your
Okay.
diet is not enough to give you proteins if you're a vegetarian. Even if you're a non-vegetarian, I'm sure you cannot match up to your body weight of having 1 gram per kg of your body weight of proteins.
Yeah.
So good amount of proteins, uh, less exposure. I mean, to I mean, the radiation can be from anywhere. It can be your mobile phone, it can be your laptop, the Wi-Fi that's there. So a little less exposure, because any kind of these exposures are causing hormonal disturbances in us.
Okay.
So somehow staying away from social media and these blue rays at least 3 to 4 hours prior to sleeping, at least 3 hours before sleeping, so
Okay.
that switch off all the Wi-Fi and switch off your phone and switch off the TV and sleep. A good sleep, 8 hours of sleep cannot be ignored. That is going to regulate your melatonin formation in your body, and it
Yeah.
affects all the hormones that deficit, which is going to give you good quality eggs. Exercise, regular exercise, meditation, yoga, being just being happy and stress free and being positive, all this really affects our hormones, and this is what I mean by naturally being fertile and being
Yeah.
away from infertility. But yes, there are some things that cannot be done naturally, like if the tubes are blocked, or if you have fibroids or malignancies or cysts in your ovaries. There are a lot of things that cannot be avoided. There is one more thing, that is vaginal hygiene.
Mm-hmm.
If that is not taken care of, the sperms can never reach the eggs.
Yeah.
So vaginal hygiene has to be maintained, and there is a lot of myths around vaginal hygiene. And if you want, I can talk about vaginal
Yeah.
hygiene also.
Yeah, in fact, actually, that is one of the questions. So I was just going to come to that. So there are some questions from our followers, and the couple of questions. The first question was myths about feminine hygiene. Can you
Yeah.
ex- expand on that? That is the question.
Gayatri these days is, women want pregnant vagina, which is not possible. God has
Okay,
no.
know that. Yeah.
So, so if vagina was meant to smell like roses, it would have smelled. like roses. So please, yes.
This
So no phones, no perfumes for the vagina because it has to smell the way it has to. Um, yes, foul smelling discharge is not normal. Um, so we have a basic pH that has to be maintained for the vagina. So
yes.
if it is less than 5, it is extremely healthy and it is going to prevent from any kind of infections. But if
Okay.
this pH is disturbed by anything, vaginal perfumes and deodorants that are available outside,
Yeah.
they can disturb the pH. If you're using
Okay.
some soap or detergent, some shampoo, which is that can alter the pH. So it is important that douching or flushing the vagina with water is not allowed. That will lead to removing of the healthy bacteria of the vagina. We
Okay.
have lactobacilli, we have good bacilli in the vagina, which protect us from any kind of fungal or other bacterial infections. If we
Okay.
keep flushing it and cleaning it excessively, it is going to disrupt the pH and it is going to remove the good bacteria. So that has to be stopped. And just good vaginal anti-wash shampoos that are available, we wash, anti-wash, genteel. There are so many washes that are available. Those are
Okay.
supposed to be used to wash the uh, and every time even from the time the child starts using the washroom, we have to inform a girl that always just wipe your after passing urine, just wipe from front to back with a help of a dry cloth or a tissue, and that again prevents from infections, general infections.
Okay.
Again, sexual hygiene, then there is menstrual hygiene. If you think that you have some girls basically have excessive discharge, vaginal discharge,
Yeah.
which is not foul smell. Okay, so that can be either bacterial vaginosis, so you just have white discharge, which smells a little fishy. That needs to be treated. But if you think that you just have excessive discharge, try to not have wet underpants. So you have to keep changing the underpants, even for a small child, for a small girl also. At
Mhm.
least change her underpants times. It is essential to maintain the hygiene. While menstruating, it's important to dispose your tampons or the pads every 2 to 3 hours because tampons are generally forgotten and they are changed less often than pads. So menstrual hygiene is important. Underpants have to be changed 2 to 3 times. It has to be washed 2 times with a vaginal wash during menses. So menstrual hygiene is a completely separate hygiene that needs to be taken care of. So these are a few things that can be taken care of to prevent infertility later on. Because remember, excessive vaginal infections, recurrent infections can lead to recurrent urine infections, and all this can lead to infections in your pelvis, which ultimately leads to infertility. So this is
Okay.
again a lifestyle thing that has to be taken care of by everyone.
Yeah. I mean, that's a good point because it's also, I mean, it's the same care that is required even for older people. A lot of older people get urinary infection, urinary tract infections. And it's again the exact same
Same
care
thing.
that,
Yes, yes.
yeah, so it's a good point. And the last question that we have for today is, are there any reproductive health symptoms that people usually neglect, have you seen in your practice, that they ideally should seek help, something that we usually don't think of, like we need to go to a doctor for, but it's required?
Yes. Reproductive health care, one is the discharge, the white discharge that I'm talking about.
Okay.
Uh, so we think that this is normal having excessive white discharge, but it is not normal. Sometimes, Gayatri, we get people with a huge lump which they neglect, a
Really?
huge on the pubis, and which is neglected because it is asymptomatic. And
Yeah.
then when we see it in the ultrasound, they have a fibroid of about 5 months child size. So yeah, many a times in young girls, these lumps are neglected. They think that it's normal, or because there are no symptoms, we can just ignore it.
Ignore it. Okay.
Anything that looks abnormal on the stomach, or any discharge or any bleeding that you think is excessive, should not be ignored. You should not just sit at
Yes.
home, do DIY. It has to be taken care of by a gynecologist. Irregular periods, excessive pain during periods. Some people just think that, mothers think that my child is too delicate and that's the reason she's missing school.
Mm.
But no, she could be suffering from endometriosis, which is a disease which needs
Mm-hmm.
to take care of. So, if a child has excessive pain during menses, you should visit a gynecologist. Please don't let her suffer, and please don't ignore it by just saying that she is delicate, because
Yeah.
that's a hidden disease.
Mm-hmm. Point.
And anything, any pigmentation on the neck, or if you think that, see, a pigmentation on the neck is actually due to insulin resistance in the body, which happens in PCOD, and there are other hormonal disturbances that can lead to insulin resistance, and you
Yeah.
just get this excessive pigmentation on the neck. So these are some signs that need to be caught. Or if you think that there's excessive facial hair, or your child needs to remove her eyebrows and there's excessive hair, mustache, or excessive hair on the upper lips or beard, and on the chin, and you just get acne on the chin, or there is hair loss, or there is hair on the body where a woman should not have, like the chest or the inner thighs or stomach. If you think that the child has this, then it is hirsutism, and that also needs to be addressed before you try and plan for a pregnancy. So there are many signs to help you.
Okay.
PCOD is definitely to be
Yeah.
taken care
Interesting.
of.
Yeah.
So there are many things that needs to be taken care of.
Yeah. Yeah, that's there's a lot of things that I also didn't know that you brought up here. That's thanks a lot. And I think those were you have covered all the questions that we had today. Uh,
Great.
and and there are lots more questions, and I think there is maybe we'll have to have a follow up on all of this at some point because I can think of lots more other questions that come up at each instance. But we can do another conversation at another point with this.
I have covered whatever I wanted to, and I hope
Okay.
I've not missed anything and I've not said anything wrong. And if
Yeah.
there's anything that anyone wants to ask, can always
Yes.
ask me or DM me. I'm always available. And
Yes.
thank
We
you
can.
so much.
Yeah. Thanks a lot, Dr. Ruchi. And can we share your um, email ID with
Yes,
for
yes,
any
yes.
doubts?
Yeah,
Yes.
yeah. My
Thanks a
email.
lot. I will add it on the link there. Thanks a lot, Dr. Ruchi, and hope you have a nice day.
Thank you. Thanks to you too.